Firstly, I want to offer sincere and heartfelt condolences to any person bereaved as a result of this virus, and to those who are ill, be they at home or in hospital with the virus. I want to wish them a fast and a full recovery. What I want to do today is ask a number of questions about the current situation, and in particular questions on behalf of medical professionals and the medical and scientific community about the situation as it stands, as well as those questions which have arisen in my constituency office and that of my colleagues. What we have here today, I believe, is an opportunity to put to bed some of the myths that have been circulating. And I know that in my own constituency, I have elderly constituents who are at home. They don't want to let anyone into their house. They normally have a home help who comes in. They are very anxious. These aren't people who don't need home help. They do, but they don't want to have someone coming into their house. That's why it is absolutely vital that we can make a statement here today with regard to the personal protective equipment that can and should be provided to home helps. That will enable us to put at ease the minds of constituents who do need their home help, but are very, very anxious about letting someone come into their house. They're very worried. Of course they are. They're doing what they should be doing. They're cocooning. They're trying to stay away from contact, but they do need their home help. And what they need to hear from yourself, Minister, is that the PPE will be provided and that their home help can visit where appropriate in a safe way. I know also that home help is going to be curtailed. We spoke about this yesterday. You can understand that that's going to cause. We've had many debates in here about the waiting list for home help, so you know how much people value that service. But I do think we need to hear from you today what is going to replace that. That needs to be said to people. But also we need to talk directly to those people at home who are watching and who need home help, who have home help assigned to them, and the home helps in many instances do want to be able to do their work, but they need the personal protective equipment to be able to do that. At this point in the proceedings, every worker in the health service is on the front line. There's no such thing as a non-frontline worker now. There's no grades, there's no differentiation. Every single person in our health service is on the front line, and every single person on the front line needs to have the personal protective equipment to be able to do their job. With regard to the situation around testing, in recent days it has become evident that a lack of reagent used in the COVID-19 test process has led to a significant delay for patients receiving test results and a significantly lower number of people being tested each day than was previously planned or indeed announced. There is an international shortage of the extraction material used in the testing process, causing significant disruption to the testing for COVID-19, not just here, but we know that this is a global issue. As this crisis grows day on day, the international demand for this material is only going to grow with it. This will put even further pressure on the testing regime here. Dr Cillian de Gascon has said that the extraction material which is used to extract the viral RNA in the testing process is proprietary, meaning strict patent laws govern who can and cannot manufacture it. The lack of it is now causing us delays here. So can I ask at what stage are the government's engagements with the pharmaceutical companies that are located here about the development of test kits for use here domestically, as the international market clearly cannot meet the demand that is going to be required? All options, including the compulsory licensing of intellectual property, should be considered in an effort to maximise production. We have a world-renowned and long-established pharmaceutical sector with the top 10 pharmaceutical companies operating here, and this needs to be utilised fully. We have thousands of highly skilled workers in this sector, and there is no reason why we shouldn't be able to manufacture the test kits and the materials here. We can't sit back and hope that the international market will deliver, because it just won't. It won't in these circumstances. And in that regard, my colleague Dr Darren O'Rourke and myself have drafted some suggestions. Darren, as you may know, is a medical scientist, has a lot more expertise in this than I do. But we have drafted a proposal. We have sent it to you. We aim to be constructive, because this is an effort that we must all make together. Similarly, with regard to PPE, I know that both yourself and the HSE have been working very hard to source additional supply from China and from other countries. But we also hear from Paul Reid that there are other large states in the market who are actively out there, and they have deep pockets. They will push up the prices. New supplies have been arriving. We saw that, and more will come, and that is welcome. But we have to ensure that we have a continuous supply of domestically produced PPE. PPE is absolutely vital, and as I said, Minister, there is not one grade group or category of worker in the health service now that we can't call frontline, and every frontline worker needs PPE to do their job, so this is going to be absolutely vital. So I want to ask you, Minister, what is the situation around the refocusing of domestic capacity in manufacturing here? What stage is the government at in engaging with domestic manufacturing sector? How much PPE can be produced here? When can it be produced? How soon can we get it out to people? These are the questions that people are asking, and they need to know, A, that this has been worked on, but also that there is a realistic time frame and that they can know when that equipment is going to arrive. On the matter of accommodation for frontline healthcare workers who have found themselves without somewhere to live due to the COVID crisis, I note that there have been discussions with hoteliers and B&B owners, and I had heard yesterday that a list would be circulated of available accommodation. That is really welcome, but that list needs to be updated. I've also had cases come to me of people who have lost a place to live simply because they are working on the front line. They have housemates who may be vulnerable and they can't continue where they are. Nobody, certainly not anyone on the front line of this crisis, should find themselves homeless or without any form of accommodation. So that list needs to be published and it needs to be made known to all healthcare workers. Can the Minister elaborate, if he will, on the public-private hospital agreement? Two issues in particular. Can I ask how you arrived at the decision to pay consultants from the private hospital network more than existing HSE consultants, namely those who are new entrants? This is an issue that's just going to cause unnecessary distress, I believe. One of the standout details of the agreement, and certainly not much of it has been made public, but from what we have seen, this is one that is causing concern. It's unfair to perpetuate pay inequality in this new agreement. It's not fair to the people who we are asking to go out and do a tremendous job in the coming weeks. Moreover, can I ask for details on how much this is going to cost? I know when An Taoiseach spoke about it, he was very clear to say we don't know how much it's going to cost because we don't know how long it's going to go on for, and that's grand, but there is a daily rate. So we may not know how many days, but we certainly should know how much per bed or how much per hospital, etc., how much that is going to cost. There's no commercial sensitivity at play here because simply this is, it's all public now, as you told me, so we really should know what this is going to cost. With regard to the nursing home sector, this is coming to the fore in recent weeks. There are a number of clusters of the virus around nursing homes, and I know that the HSE and the medical professionals are doing sterling work to try to stop the spread and to treat people as best they can. Can I ask you, Minister, that you do two things? Firstly, make sure that staff working in nursing homes have the necessary PPE, and can you also ensure that they have the necessary staff? So we all saw the call that went out to be on call for Ireland, and people are, but on call for Ireland has to mean to be where you are needed, be that in a nursing home, be that in the community, be that in an administrative role, in a field hospital, in a step-down facility, in a clinical hub. On call for Ireland has to be where you are needed, and our nursing homes absolutely need staff to keep the residents safe, to ensure a steady supply of staff. So we all know that staff in nursing homes are contracting this virus. They have to take time off, but the residents still need to be cared for. Can I ask that you look into the situation around student nurses? I was contacted by a nurse the other night. She's lost her Susie grant now because she has volunteered to work on the front line. She's no longer eligible. I fully appreciate this is an anomaly. I know it is an unintended consequence, but it is one that does need to be addressed. We can't have a situation whereby people are signing up to work and finding themselves in a situation where they're losing money. Likewise, student radiographers and other students who are signing up to go to the front line are finding themselves in a situation where they're either not being paid or they're losing money. The situation regarding those who are in receipt of medicinal cannabis, that needs to be clarified. I think you have some information about that, and I know work was done on it, but that needs to be shared with us. And I want to put, as I've said, I put the questions to you, Minister. I've tried to be constructive. We have tried to be constructive at every step of the way in this. I have offered solutions, I have offered suggestions, and you have our support in terms of the efforts that are being made. But we do need to get some answers onto the public record. As I've said previously, before I conclude, I want to say very quickly, every healthcare worker is on the front line now. There's no grades, groups, categories, but we also have to say thank you to those who are working in supply chains, those who are keeping our utilities going, to the men and women working in the background in administration. All of those people are going beyond. We have been inundated, Minister, with requests for information. People want to know what is going on. They want to know what the plan is. They want to know where they stand in this. They want to know what is going to happen to them. This is our opportunity to put into the public domain the facts, because there are a lot of myths out there, and we do, as an Oireachtas, need to ensure that we can counter those. And Minister, I have tried not just to pose questions today, but also to offer some solutions and to ensure that we remain open in our dialogue and that we remain frank with people and that we put all information that is available. But I would ask you, Minister, to please look at the issue around testing, to consider the proposal that Sinn Féin has made, and to know that we will work with you to ensure that we can get these tests here, because testing is key. The WHO says it. All the medical and science community say test, 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 trace and isolate. But we have to test first. And as I said, we've made a proposal in that regard, which I hope you will have time to look at.
Thank you very much.